So the first thing you'll notice is that we set the patients up in a very similar fashion to if we're going to do the procedure from the leg, from the groin, and we're doing it from the radial artery here. So this gentleman's arm is extended out and it's on a comfortable roll. Okay? Next thing is I'm going to apply a little bit of numbing medicine, a little bit of lidocaine, and that's just to numb up the spot where his blood vessel is. A little tiny pinch. And for those of you that have had a PPD placed before, it's a tiny little wheel like that, and it doesn't hurt. This is the wire that I'm going to be passing up. I take my small needle, go through the blood vessel, and then come back out, pass this wire up. And sometimes it's a little tricky. Take a scalpel and make a tiny little nick here in the skin, just to make it easier for us to pass our sheath up. And this is a hydrophilic sheath that has a coating on the outside that makes it very slippery, so when it goes into the wrist, it actually doesn't hurt. And it's just as important for it to go in smoothly as it is for it to come out smoothly.
You're welcome.
Thank you.
You're welcome.
Then we wet it, make it a little bit slicker, and pass it up into the wrist. Once we're in, we actually inject a little what we call radial cocktail that has a combination of some medicines, including heparin, which is a blood thinner, nitroglycerin, which helps dilate the blood vessel, and nicardipine, which also prevents the spasm in this arm. When I'm done, I'm going to just pull up here and take the tape off of the wrist, and then we'll see what we do is we end up putting his arm into the arm board, and now when I stand and do my procedure, it's as if I'm doing it from the groin, but I'm actually doing it from the radial artery. So now the rest of the procedure is very similar. So here we are, we're passing up our catheter. Take it out, please. And we're going to see if this gentleman has any blockages. And saline, please. Stop. Con. Okay. Con again. Great. Test. Sir, take a deep breath in and hold it. Test. Okay, breathe normally now, please. Great job. So we're going to take our pictures. Hit it. Great. So far, so good, sir. Okay. We're taking pictures. I hope you're comfortable. Inject. Looks really good, right?
Yes, sir.
Beautiful blood vessels. Hit it. Great. And usually at this point, patients don't realize we've already started, but we're almost finished the procedure. We're actually finishing up pictures of the left side, and now we're going to get ready to take pictures of the right side. So we're going to exchange this catheter out over a wire. Going in with our catheter to engage the right coronary artery. Okay, hold it in. There we go. Back it out. Touch a con, please. Good. A little test. Test. Great. Let's take a picture. Ready?
Ready.
Inject. Beautiful. So, sir, I have great news for you. You have no blockages in your blood vessels. Isn't that great news? And we're almost finished. I have one more picture to take, which is to see how well your heart squeezes. And during that picture, you may feel a little warm and flush from the contrast. And when we're done, I'm going to put a little wristband on, and you can go home in an hour and a half. How's that sound? Great. And sir, take a deep breath in for me and hold it. Good. Good. Okay, back it out.
Right south, just goes going in. Breathe.
Yeah, breathe. Sorry, sir. Breathe. Breathe normally. Okay. Here comes that picture, okay? You're going to feel warm and flushed. It's only going to last for a second. Touch. 0, please.
EDP of 26.
Ready? Inject. Great. Perfect. Well, your heart is nice and strong. You have absolutely no blockages in your blood vessels, so we're all done, okay?
Okay.
0. Here's your pullback.
Ready for pullback.
Great. So you can see that a heart catheterization procedure is actually fairly straightforward. I always tell patients it's easier than going to the dentist, and they never believe me till we're done, but we're finished. When we're done the procedure, you can see we did the whole procedure from this small catheter in the wrist. There's nothing to really clean up. There's no bleeding around it, but we do wipe it off. And then I put this band, this comfortable wristband on that actually has an air diaphragm that inflates and holds pressure, and it's a Velcro strap. It's called a TRANSRADIal band, or TR band. And we put it on. It's like a wristband, a little watch band. It doesn't hurt. It's nice and comfortable. We inflate this, the air diaphragm, with this syringe. We slowly take out the sheath and then reduce the amount of air in there. And you can see that the whole procedure was done this way, through the wrist. And this stays on for about 90 minutes, an hour and a half, and then patients can go home after that. All right, so you did fantastic, okay? No problem. Real pleasure meeting you, okay? All right, thank you.